Good evening, everybody, and welcome to episode 4 of the Caring View chat show. We have lots of follow-ups from episode 3, in which Donna was the host, in relation to the 14-day isolation guidance, which was overturned and abolished by the government this morning, from what I understand. So we created our own poll, and my trusted assistant, Adam, if he could show that, to discover what everybody thought over the last probably 7 days since episode 3. And 88% of everybody who voted on the poll agreed that they didn't feel that this guidance went far enough. So I was just wondering, Donna, how do you feel since episode 3?
I mean, it's fantastic news what we've heard, that it's been overturned. I still do feel that a lot of it is the government now backpedalling. As we know today, our friends and colleagues from Rights for Residents have been down in London. And it's all, I do think it's a lot of lobbying that's kind of sort of overturned it. However, we aren't still getting where we wanted to. And if you remember Shakila talking last week about her son, Jake, and all he kept saying was home, home, and that she used to have him, back home one night a week. So it's all right saying that they can now, go out in the fresh air, but going out in the fresh air should be something that everybody can do. So it still really doesn't go far enough. They should be able to certainly go back to families' houses. So I'm just hoping that there is going to be a change on the 17th of May. I think we've just got to keep our fingers crossed and, hope that there will be. So, yeah.
I think we've all done a lot of media over the last 24 hours. Adam, I know that you've been quite impacted and you have enabled residents to go out for quite a while now. So how do your residents and relatives feel?
I mean, I have this conversation with the news quite a lot, and they'll go, can we talk to someone about how they're going to feel when Tuesday comes and they can leave the home? And I'm like, you can do, but they've been leaving the home for months now, so I don't know what you're going to get from them. People in our services are really none the wiser. I mean, we do have to give a massive shout out to Lee Day and John's campaign for their legal campaign against this. I do think part of the reason they backed down so quickly was they didn't want to face that legal campaign. But when I found out Friday evening that they were changing it and we started to hear what was going to be in supplementary guidance, there's they've given with one hand and taken away with the other. So they kind of, it's fine. People are allowed out now, but they must be accompanied. You've got to chaperone them wherever they go, and they can't go indoors unless it's to vote. And make sure that they vote, and we need to make sure that they vote when they do go out. So it was a really disappointing, I think, kick in the face when we saw the guidance in its full entirety. I mean, I actually said I'm going to sit down with the brew and digest it. I hadn't even opened it up, and when I opened it up and it was 5 sentences long, I was like, oh, that's it. Okay.
And what about you, Mark? Because I know that you've moved on from the care home now and are working as a regional, but how do you feel about the change in the guidance?
I think for me, it definitely doesn't go far enough. I think there's going to be so many relatives that need to pick up a resident that live in an isolated area. So they're probably going to have to get into their car, but then can't take them into their house. That doesn't make sense to me. And also, I think for people that are independent, it's a huge step backwards. So they're going to have somebody with them when they're going out into the community, even though they would have been deemed as having capacity to be able to have left that care home themselves. So it's almost taken away somebody's rights.
Exactly. So we just wanted to thank everybody who contributed over the weekend, and of course to our amazing friends, the Right for Residents group, who delivered their petition today to ensure meaningful visits, and contact is enshrined by law to Downing Street. So we hope to keep everybody updated as much as we can. So just a reminder that all the views expressed this evening are our own. They are not of our employers, and to click on the bell to subscribe so everybody's kept updated on future shows and what we have coming up. There. So I'm hosting this evening, and tonight's big topic and discussion is the impact of the pandemic on those who work in social care. And as it's Mental Health Awareness Month, we thought we would kick this off with some amazing people and some guests to help us in the discussion. We continue to encourage you all to comment and ask questions throughout the next hour, so please don't hesitate to become involved, and we will show these comments up on the screen so we can interact with everybody. So in relation to tonight's topic, this is something that's really, really important to me after the impact of the pandemic that had on my own mental health. And to continue with the honesty and the rawness that Donna was talking about last week, I was planning to discuss my own impact with the other hosts, with Adam, Donna and Mark, and our amazing guests. So we have Carolina Gerlich from the Care Workers Charity, who's done amazing things to support the care workers throughout their pandemic journeys. Sarah from the Samaritans, who, as well as working in social care, moving into a care home during the pandemic, also worked for the Samaritans as a volunteer all the way through. And Jackie from Ash Counselling and the Counselling Directory. And I think this topic is so close to my heart because honestly, I can honestly say my mental health was severely impacted probably from April to September, October, when we started testing last year. And that was mainly due to an initial outbreak we had in the home between April and May, where we lost 9 residents. 3/4 of all staff working in care homes at the moment, according to the GMB union, want to quit and never return to social care. And I spoke to the GMB today upon relation to this, and according to them, the anxiety levels amongst the care workers questioned were 44% higher than people working across a broad range of other jobs, including those who work in retail. 2/3 of all the respondents said their biggest worry had been that they might take the virus home to their relatives and their families themselves, some with young children or those who lived with those that were shielding. So there was that difficulty where people were going into work and needing to go to work, but not knowing whether they were taking the virus back. The research carried out in December and January, as the second wave of the virus was having the greatest impact. And it prompted nearly, I think it was 1,300 responses, mostly from England, but from all other parts of the UK. So can I ask all of you how you felt the pandemic impacted you day to day? Adam?
I mean, maybe I'm coming from a different angle on this. We've been very lucky that we've not had any outbreaks in our home. We've not had any deaths. We've had no cases. So for me, the stress has been from maintaining that. You know, it's been maintaining that level of safety and security and hoping to gosh, it wasn't a fluke and it was actually down to the hard work. I mean, the hardest part for me has been my disconnect with my actual family. You know, coming into work absolutely every single day, seeing so many different people, and I won't get upset about it, but I have a brand new nephew, and I've seen him 6 times since he was born. I've held him twice. You know, he's a year old at the end of next month, and it's like it's just been so difficult. And I think we've got so lost in protecting everybody else that we tend to put us last, and that's everybody else. I mean, that's the staff, that's our residents, that's their relatives. You know, it's absolutely everybody, and making sure that they're okay. So for me, that's been the hardest part of it all. I've coped fine at work. You know, it's not really affected me that much. Yes, there's been stress, people working policies at 11 o'clock at night nearly every Friday, but it's the personal aspect for me. It's the coming home to the same 4 walls and the same person that you live with as much as you love them. That's all you see for 12 months, isn't it? So that's where I've really struggled.
Donna?
Coming at it from a different angle, I think what I found hardest was the criticism. So, you know, at the very, very beginning, I said, you know, I am going to keep everybody safe. But of course, I wanted to keep all the residents safe. The thought of one of my residents dying of COVID it horrified me. It scared me. And honestly, Dawn, it breaks my heart because I can't imagine how you felt being a fairly new manager and being in that scenario. You know, I felt very much on my own. Yes, we are an independent one-off care home. So I didn't even have anybody above me telling me what to do. It was more me going to the trustees, do you think this is right? And bless them, going, well, yes, it sounds right. And I was trying to please everybody. I was trying to please the staff. I was trying to please the residents and the relatives. They'd all got their own different worries. They were all scared about different things. I didn't have the answer to everything. You know, it didn't matter where I turned to, whether it was Public Health England or whether it was a local CCG. Everybody was learning as we went along. And I think what I struggled with was, and I don't want to be derogatory to my staff because they've all worked tremendously hard. But I'll be honest, as a manager, I felt very under-supported by them. To the point that I don't know who it is and I don't really want to know who it is, but one of my staff members decided to report me to CQC for not being safe. Now, you know, I then get a phone call from CQC, you have to explain everything. I was so lucky. Yeah. She was the nicest CQC inspector. She'd done some of her research on the home and on me before she contacted me. And she was lovely. And I did come off the phone and she was satisfied. But I thought, why have I just had to do that? Why can that staff member not just come to me? You know, I have an open door policy. I'm such an open manager. Why they not just come and say, Donna, we don't get why you're doing this, or can you just explain this? And I felt just very much that I was literally, you know, working 50, 60 hours a week, coming home, poor Carl, bless him, back here, all he ever got from me was being the most grumpiest, mardiest, middle-aged, menopausal woman that you could ever wish to live with. You know, whilst at work, I'm trying to keep this smile on my face. And yeah, I felt very much that I was doing it kind of all on my own. And I get it, as a manager, we're not in a position to be liked. We know that. You know, not everyone's going to agree with the decisions that we make. But I just really struggled with so much kind of negativity. And when I kind of, you know, I said several times, you know, do you want to come and do my job for a week? Because you're more than welcome to it. Because I'll tell you something, I am really just not enjoying it. And I'm not saying I thought about quitting because I was determined to get through it and everything. But yeah, and I was coming home. I'm not going to deny I've drunk far too much wine in this past year. I've ate far too much food in this past year. But it was almost like comfort eating, because it was what makes me happy when I'm back home, you know, because I've had such a rubbish day. All I've had is people have a go at me about whatever I do. So I just came home and binge drank and binged ate, and I'm sure there's probably a lot of other people, you know, in the same position, really. So yeah, I found it very, very tough, I'll be honest.
Yeah, and I think that I found it isolating as well, because I was the only one getting the guidance and the feedback and having to feed back to staff consistently. And I know at where I was employed, it was the fear in people's eyes. So people we'd have this big handover every morning. We have a huge reception where I work, and we'd all collate together so we could all stand socially distanced, and people would literally stare at me as if to say, okay, what happens now? And I didn't have all the answers, like you said. So you'd stand there watching the fear in people's eyes. So I can definitely understand feeling isolated. What about you, Mark? Because you moved out of your family home to protect your family.
Yeah, you know, I think that when I look back, it did take an incredible toll on my mental health. I think in the early days, even before kind of that happened, it was kind of touching on what Donna said. It was making that contingency plan. And, you know, mine was a small home. It was 13 residents. And having to make that contingency plan of if the virus entered that whole care home, which resident I was going to support first, which one possibly we might leave, because I knew that the staff ratio to residents, we wouldn't be able to get to all of them at any given time. And that really played with my emotions. And then sending that out to the staff who were like, well, what about this one? Or what about that one? Are you not going to say, you know, it was almost like the blame was then put on you. I think one thing that I struggled with as well is that we saw so many staff impacted, and you guys probably still see it. You know, I'm not kind of there on the front line anymore, so I don't see it, but signposting the carers to these amazing resources like the Care Workers Charity or the Samaritans, but not actually knowing whether they were actually going to use that information, and I think that's one thing that, in social care we miss. We signpost everybody everywhere, but we never actually follow it up with them. And I think that's one thing we've got to do. And I think one of you just touched on it. I think as a manager in social care, we're there supporting everybody else, but very little, do many managers get the support from their directors or the owners of the company with their mental health. And that's definitely something that needs to change in social care.
Yeah, absolutely.
And I think, and the impact that they had on the staff, because obviously, as you all know, we had quite a terrible outbreak at the beginning. We had somebody discharged from hospital. We didn't know he had COVID. They rang 2 days later, informed us that his test had come back positive. And I think it was for them, it was the guilt of going home. And it wasn't necessarily the guilt of being at work. It was the guilt of going home and not knowing whether they were taking COVID home to their children and families. And then we had the Prime Minister blaming care homes for the COVID outbreaks. And I know that massively impacted the staff where I work. They were fuming to the point where I literally walked in the building that day that he made that announcement, and I had 6 or 7 staff saying, "This is disgusting." And I think with the Clap for Carers, that really helped us. And I know that some of you didn't like Clap for Carers, but that really helped us as a home, because every Thursday, everybody would get together and we'd all clap and we'd make a big deal out of it, even out the front or within reception. And I think that the impact of my own trauma was I didn't know any of the relatives the day I started. 2 weeks later, I'd arranged a relatives meeting. I was ringing families saying that we had closed the home. And then I was ringing families to say they had gone into hospital because we suspected they had COVID-19. And these people had never even met me. And I remember sitting in my garden one day and saying to my husband, "I am not keeping people safe and I can't do this job anymore." And like I've said before, I resigned a few times because I literally felt as though I wasn't keeping people safe because I didn't know who had COVID and who didn't. And that had a massive impact on my day-to-day at work. And in the end, we had testing, which was the biggest impact where I'm employed. It made such a difference to the extent where we were testing, but then at the same time, I was awake from 2 o'clock in the morning because their results would start coming through, and I'd hear that vibration on my phone, and I couldn't leave it. I had to check, because my main concern was then, is somebody working the night shift, or is somebody due in at 8 o'clock tomorrow that is tested positive? So I couldn't leave it. I had to check, and I'm scrolling through and then scrolling through again because it's 2-3 o'clock in the morning and I want to check and I need to double check because I'm tired. So I think the impact on me got to the extent where I rang my doctor and I spoke to my doctor, and he prescribed me sleeping tablets and told me to contact the Wellbeing service, and that was all I got. And I've always felt confident in my job, and I've always felt confident in what I was doing day to day until the pandemic hit, and everything's all over the national press, how residents are dying and how many residents are dying, and the research and the testing. And in the end, I had to pay for my own mental health support. And on top of that, what our director has done is paid for all the staff within the care home to have that mental health support, because we couldn't actually get anywhere. And that's where I think the poll comes in, because the stigma surrounding obtaining support for your mental health is huge. And Adam, if you could pop the poll up for me.
I will do. Do you want me to bring Carolina in at this point?
Yeah, that'd be great.
Let me just get
so Carolina Gerlich is the CEO of the Care Workers Charity.
Good evening, everybody.
Hi,
Hello.
Carolina. Are you okay?
Thank you for joining us.
Thank you for having me.
So I wanted to discuss tonight the amazing things that the Care Workers Charity have been doing. So I thought you could let us know, because I know that you've been supporting 2 million care workers in the UK, offering financial help and grants, and you've also now been offering counselling support.
Yeah, so just listening to you all talk, some of the heartbreaking things that you've all been through. And like you say, across the UK, around 2 million care workers that have experienced incredible hardship, especially around their mental health in the last 12 months, but also physical burnout. I think, we need to be very honest about it. Care work does take its toll on your physical health as much as it does on your mental health. I started the Care Workers Charity end of March last year, just as we went into the first lockdown. So as of today, I still haven't met my team, which makes for an interesting way to work in a charity. And for the first 6 months, I was still doing a couple of visits of home care on Friday mornings. So myself, I experienced the difficulty in London of traveling on public transport, of these wartime announcements that were stressing me out incredibly. Every time I got to the tube, I was checking with myself, should I be here? Am I actually allowed to be here? It was so stressful. And then having to queue for the shops when I was doing shopping for people I was supporting, because I wasn't being let in special shopping hours or at the front of the queue because I didn't have an NHS ID. And especially at the beginning, nobody was really accepting that care workers are key workers and need the access as much as NHS workers do. So in terms of the work of the charity, we started a fundraiser at the very beginning of April last year. Our initial goal was £100,000. And with the public support of the sector and from big trusts and foundations, we actually managed to raise over £2 million. And in the last 12 months, we paid out. Yeah, and it's been, you mentioned clap for carers, and that was an interesting one. Obviously, the general public did give social care more support than we used to, but unfortunately, it was very short term. I think the Prime Minister's speech, Dawn, that you mentioned, putting blame on care homes really did a lot of damage. And we were back where we were before the COVID, if not even further backwards than where we'd hoped to be. And I myself witnessed a lot of care workers and care managers on online forums that day saying they just can't take it anymore. They can't go into work, sacrificing as much as they have, to at the end of the day hear that it's been their fault that people have died.
Yeah.
We've had applications, heartbreaking stories from care workers working full time, unable to pay their bills, unable to feed their children. It is still an ongoing difficulty in the sector, the pay that care workers receive and lack of funding from the government into social care altogether, and lack of reform. Around COVID, the most difficult things were self-isolation in the first 3 or 4 months, where there was no PPE and no testing. And care workers were put in this incredibly difficult situation. There were really no right choices in a way, because it was a choice between putting the health of people they work with before the well-being of their family, because taking 2 weeks of work with no pay or only on SSP takes a huge financial toll on somebody who is on low wage. So majority of the funding we paid out towards those 2 weeks of isolation or 12 weeks of shielding, where care workers were sent shielding letters. And again, it was the lack of support from the national government to social care, especially in the first lockdown, first weeks of the crisis, when it wasn't recognized that social care is at the front of the fight with the virus. It really needs investment, it really needs support to help people as much as we can. And I have to say, right now, personally, I am very concerned about levels of staffing we're going to have once we come out of this. I think many care workers, many care managers, you talked about your own difficulties. Care managers are just completely worn down. That's one of the reasons why we started mental health support. We do realize that a care manager juggles on a good day 5 different roles, if you add into the mix a global pandemic and ever-changing guidance that you have to keep on top of, it really makes the job really impossible for one person to do, and the level of responsibility. So yeah, the mental health support is there for people to apply for. People can access up to 10 hours of one-to-one therapy that they can do in their own time, on their own schedule. They don't have to pay anything. It's with accredited specialists. It doesn't have to be COVID related. You know, it could be about any kind of mental health issues that people have. But yes, we are concerned about the slow pace at which people have been accessing the support. You've mentioned stigma around mental health. That's definitely a problem. We have a workforce that is used to being neglected in a way and looking after other people before ourselves. So that feeds into it, because, you know, the care worker is sitting there, oh, somebody else needs it more than me, so I'm not going to apply. And people still, I think, right now in a crisis management mode. So they're not necessarily in the headspace to think, actually, I need help. Because Mark, you mentioned, you know, you said looking back, your mental health actually was really affected. But in the midst of it, it's very difficult to recognize sometimes, I think, for people, how badly you're affected. So yeah, it's been an incredibly difficult year. Clap for carers wasn't enough, will never be enough. I was hopeful May last year that maybe because of the difficulties and the level of deaths, of impact on the wider society, that this will really bring around a quicker reform for social care, quicker investment and recognition. But unfortunately, that all seems to have faded away. Like I said, we're back where, oh, maybe social care will be mentioned in the Queen's speech, and now yes, it will be mentioned, but no, you know, certain plans will be mentioned. And if now is not the time to deal with it, when is it? I can't really think right now what worse situation we could be in that really highlights the importance of social care to get, you know, the fire there to get things changed.
I mean,
yeah, and I think the media reports today suggest that we shouldn't, that this social care reform and the looking into the pandemic and the impact on social care isn't going to be done until next year due to the expense. So, and there's been several media reports that have come out throughout the day.
Yeah.
Sorry, Adam.
No, I was just going to say, just before I bring Jackie in, because Jackie's joined us as well, I think you touched on a really good point, Carolina, and it's about burnout. Because as much as I've not struggled in regards to the pressure of COVID within our home, I did go home every single evening and continue working until midnight. I had all my work emails through to my personal phone, and I'd go to sleep and I'd wake up, and the first thing I'd do 2 hours of emails before I got to work. And it's about recognising self-burnout, isn't it? On top of everything. I'm just going to bring Jackie in now. Is that okay?
Yeah.
Hi there.
Hi, Jackie.
Hi, hello. Thank you for inviting me. I think I had a bit of a technical issue. I'm now on my iPad. I was waiting there and nothing was happening. Anyway, it's good to join you. So I'm not really aware of what's
So, Jackie. Oh, okay. So we've just been discussing the impact, and Carolina was talking about the impact in respect of the social care staff managing to be able to get grants with 14 days isolation. I know when we've discussed over the last week in respect of this show, you wanted to discuss the impact on NHS services.
Well, I mean, where I come from in terms of that, I'm a therapist in private practice, and I guess that it's about having an awareness of the pressure, as we all know, on the NHS, GPs, and that clearly more needs to happen so that people can access low cost counselling, or that there are ways that care homes can, that the owners can, well, hopefully address this, in that it's left to individuals to seek out their own support. But clearly, simplistically, if people are, like Adam said, burning out, then they're no good to anybody, are they? You're no good to anybody. And it's actually important, in terms of a strong, healthy workforce, is going to be a benefit to the care homes and to the residents. And I guess there needs to be, you'd hope that collectively people can turn to their colleagues, but actually it's so there's something about, to not allow people to be isolated, but to support your colleagues, but also for there to be somewhere for them to turn to. So clearly, if there is we know about dialing 999 or getting in touch with our GP, but when those services are so pressurized that we need other resources, which is in terms of, we look after our physical health, so about looking after our mental health. And I think that, when I spoke to you, Dawn, it's about the importance we put on ourselves, really. And of course it's difficult that that we can give that much attention, if you like, to ourselves, but to invest in, and of course I'm an advocate for it because it's what I do, but if there is the possibility of going for some counselling, because of what everyone is going through, it's a tremendous trauma. We've got this trauma of loss, of death, so much that I don't need to tell everybody, but it's like we just need to connect and look after each other. And that in terms of coming out of this, I was saying to someone today about the idea of deep sea diver and getting the bends, and it's like you just have, we need to kind of re-emerge into this world now and to think about ourselves. There are low-cost counselling services out there, but I guess it's that, and some people may have medical insurance that will cover that. But I suppose I think I picked up that Carolina was saying about people not having that awareness, and sometimes it can be that the burnout has come, and it's like when someone has gone into depression or something, but it's about communicating. So to be able to, there's a stigma around mental health, and yet 1 in 4 people have issues. So it's important for us to be able to share with each other and to be there for each other.
I mean, I think something has to be said for the stigma of it. We all talk about self-recognition of whether we can recognise whether we're at burnout or whether we need help. But then there's also that worry that, for me, I want to put the bravest face on at all times, and I never want people to know that I'm not doing okay. And the minute you go, I'm struggling, I'm not okay, I think there's a sense that they'll look lesser of you. Oh, you're not going to cope in that job then. You're not going to be able to do what you do. I know Carolina is going to have to leave us in a second. Carolina, have you experienced anything like that with people and that stigma around it just before you go?
Oh yeah, there's definitely stigma around asking for help. I think mental health first aiders in the last couple of years that have been promoting in the industry have made a big change around that, but we still have a long way to go. I think as a society, we still don't discuss mental health issues enough. It's still a matter of taboo. It is still definitely that kind of thing, oh, I'm too weak to cope, so I need help, rather than I've been given too much to do, so I need support. And that's the way it should be approached. nobody should have to deal with what co-workers, managers, everybody else really at the front end have had to deal with in the last 12 months. It's beyond, I think, anybody's capacity and their mental health to be able to do it and at the end of the day still be okay. So it's important, I think, that leadership in the sector talks about mental health, that we're open about it. You know, I've had anxiety. Well, it's an ongoing issue for me. I've had depression. I've taken antidepressants. I believe that if you have a problem, if you realize that you do, because realizing it's difficult in the first place, you should try and ask for help, and help should be freely offered and support at your workplace as well. Especially that it is a huge part of what we do in social care, supporting well-being, but also, you know, as part of it, mental health of people that we work with. So if we are in charge of supporting somebody else's mental health, how on earth are we supposed to do it if our own mental health isn't right and we don't get that support? So yeah, I think more conversations, more being open about it, trying to get rid of the stigma by just making it an open conversation in a way, an expectation that if you've been through something as traumatic as working at the front line of a global pandemic, you should be expected to have problems, you know, experiencing PTSD, depression, anxiety, burnout, and that should be addressed. And that help should be available to everybody, no matter what wage they're on, no matter how many hours a week they're doing, no matter their family situation. But I think we're a long way away from that. But we definitely need to learn the lessons from the last 12 months and try to promote mental health support as something that's not a nice extra to have, because I think so far it's definitely been, oh, you know, you are an outstanding employer because you're providing mental health support for your teams. It should be a requirement, a basic requirement for social care services, for social care as a sector, for that to be for everybody. And I think the point about managers is very big, that managers take on so many responsibilities, but very often don't get the support, various reasons for it. You know, people are busy, managers themselves, I know, are not always, it's not always easy to admit that they need help. Like I say, that kind of potential sense of failing or not doing enough. And we need to find a way where the responsibility is shared. So I would never consider suggesting to somebody that a manager should be the mental health first aider in a service, because that's just not right. It should be somebody completely separate who then can also watch out for the manager and see if they need that help and support. But in the first place, we just need to talk about mental health more.
Absolutely.
Yeah.
Thank you so much for coming to see us this evening.
Thank you very much for having me.
So we can find you on Twitter, can't we, at the Care Workers Charity, and your website's up on the screen at the moment. So, like you say, it doesn't cost anything to people. Go and have a look. Go and support Carolina and her team.
Thank you very much.
Thank you very much.
Always welcome.
Thank you.
Bye-bye.
Do you want me to bring our last guest in?
Sarah in. Yes, please.
Hi guys.
Hi, Sarah.
Hello.
So the lovely Sarah has volunteered throughout the whole of the pandemic for the Samaritans, and has been taking telephone calls from members of the public, as well as working in social care, working on average between 50 and 60 hours a week, because she's a workaholic, and at one point moved in a care home. And I feel that the Samaritans needs to be massively discussed, because upon research, I think there was something like 1,700,000 calls to the Samaritans over the past year.
Yeah, that was just in between like our first lockdown last year. So between March and December, we supported over 1,700,000 callers. So yeah, that was like, obviously the impact of COVID was massive, and I think every single, from what having like spoke with other SAMs and stuff, every single call that we took related to COVID in some way. So in one form or another, it was linked to the virus.
That's absolutely
So-
bonkers.
Yeah.
That's crazy. And from what I understand, from talking to a SAMS representative this evening, they feel that was because the GP services were overwhelmed and the Wellbeing service was felt to be overwhelmed, so people were turning to the Samaritans.
Yeah, I think quite a lot of contact that we do have is always linked to kind of mental health support that's required. There's lots of different stuff, but because the mental health charities seem to be so stretched, and in the pandemic, like the lack of other support that was available, they were literally coming to us. So and we were just doing it the best we possibly could. You know, for some people, they just want to be heard. You know, they want to know that someone actually cares, or someone's going to take the time to listen to them. So I think when I was trying to think back to the sort of things that we were going through over that first lockdown, like that was really, really intense. And I think it's intense for us as well, because you have people isolating. So generally you kind of do your voluntary, perhaps one shift a week or whatever. And the contact had gone through the roof. Perhaps didn't have as many volunteers because some are isolating. And obviously people were still working and stuff like that. So yeah, it was really intense. And it was, like I said, every call was linked to COVID. So whether that was mental health worries, physical worries, like just the general fear of the unknown, because no one, you know, we've got this virus that's kind of overtaken the world and no one knows enough about it. So there's that fear of the unknown. The financial side of things, economic side of things, like for people that were, say, self-employed and stuff, they had no security around their employment. They didn't know if they could survive it. You know, everyone's got mortgages, kids are off school. So like there was obviously, and this not necessarily through Samaritans, but across the board, there were kind of information coming out about domestic violence had gone through the roof, and violence within families had, because children couldn't get to their, you know, for children that were perhaps trapped in abusive families, they can't get to their safe haven, which was school, because schools were shut, so they're stuck at home. You know, there was such a massive impact on people's well-being. And then the obvious one, which is, you know, emotional and mental health worries, and that isolation was, you know, one of the biggest things. Some people literally had not seen a soul for like 9 months. Someone had dropped their groceries at the door. They weren't even allowed to have a chat with them. They just dropped them on the doorstep. You know, some people had no families, and they didn't see a soul for 9 months of the person that got their groceries off, and then the only people they spoke to would be us. So it's really heartbreaking. It is, when you think about some people being completely isolated, and you know, you worry about how they've coped, really, to how they've managed to get through it. And for me, I felt they were so brave to contact us, because it could be really easy to completely give up, you know, if you feel you've got no one. So yeah, it was a crazy time. Crazy time.
And as well as that, you worked full time with me, and you lived in a care home for a period of time to protect your family, because obviously your parents were shielding.
Yeah. What
kind of impact did that have on you, on top of volunteering for the Samaritans?
It had a massive impact on me. I think it was so close to home for me, because obviously we're working on the front line and we're seeing it firsthand, and I could relate to like a lot of our callers with that fear around this unknown virus. You know, all we heard on this was this stuff on the telly about what the symptoms are going to be, and actually not that many people had those symptoms, so it's really frightening. You didn't really know what you're looking for. But yeah, personally, it was extremely intense, and I think I do this thing where I'll look at helping someone else, because then I don't have to think about how I'm feeling or what's kind of going on for me. I put it into someone, like helping someone else. So I think Samaritans did help me in that, but there were times when I did feel completely overwhelmed by the whole situation. And like you say, my parents were shielding, so I did stay stay at work for a while. But when I did go back, there was that worry because it's just on you all the time that, you know, what if I'm taking it home? You know, because obviously they were kind of very high risk. So yeah, it was. Yeah, it's sometimes it's almost surreal when I look at where we are now, and I think, you know, I feel immensely proud of the people I work with and volunteer with to have gone through something like this. And sometimes I sit here and think, I don't know how we managed it. I really don't, but you know, we did, and we did because we all supported each other. And that's the same with Samaritans. You know, as much as we're there to help the general public, we're really close. As in, there is always support on shift. You know, there's always a leader. There's always another Sam on there with us as well. So it's not kind of a lone thing, which is good. There's plenty of support out there.
So, Jackie, in order for people to have a referral to a private counsellor, how would they go about that? Is that more through their GP, or can they go through the Wellbeing service?
Well, it kind of depends, really. So here in Norfolk, people can talk to their GP, and excuse me, there's I'm one of a group of credentialed therapists that are on the Mind website. So, you know, it's about looking, really. So by looking on the counselling directory, Psychology Today, I mean, you can go to your GP. I'm not really sure how, you know, more broadly how that is, but I do know in Norfolk that people might, you know, go to for private counselling. And there are, I mean, I think that there are agencies out there who have, in a sense, suffered the same thing, in that, you know, that they've been locked down. People are going to see a counsellor via Zoom or by phone. I mean, I work for a charity in Norfolk, and that's how we've been operating and then in extreme circumstances where there's been people at risk, then we have worked face to face with them, but it's very limited, and we're now coming out of that. But in terms of going back to the point really that Carolina made, which I think is really important, about staff getting support, because I think that that's like a huge part of how it is for a lot of people that are watching this, and for yourselves as well, about the need for mental health to it be part of training, almost like, so you might have training on whatever you have training on, but for that to be, you know, your self-care is like a mandatory training for everybody. So I think that there are things that can be done which are smaller, in that, you know, it's not like lots of money being spent on counselling or therapy, but like if individuals feel, you know, that they've experienced, you know, like lots of residents and things, then I think there's a responsibility for care home owners. I worked 25 years ago for a charity in Norfolk, and they paid for staff to have counselling. Now that was 25 years ago, so this sort of thing should be happening as a kind of, as part of, almost, it's not a perk of what we do, it's that it should be there, because otherwise it's really so very damaging. I know I keep harping on about that sense of things, but you know, if we haven't got well people, then it's not very fair on the people that we're trying to look after.
I mean, I think you bring up a really good point, because we've offered mental health support to our teams. We've offered wellbeing classes. We've done wellbeing training, and I think people, it's probably our fault, because we felt, oh, we must throw all of this at our team to make sure that they're okay. But I think unless we've got it within the culture of the company and we talk about it open and freely, there's always going to be a low uptake on it. And just to touch back on what you were saying, Sarah, about the rise in domestic violence issues and the lack of safety at homes during lockdown, we need to know our teams. We need to be able to talk to them. I'm a huge LGBTQIA plus advocate, and what broke my heart last year was during coming out week and things like that, people were advised not to come out at home if they felt unsafe. And that feeling of not being able to be yourself at home is heartbreaking. And then to come to work and have to deal with a worldwide pandemic, it just must be absolutely horrendous. So what would you say to people like myself who probably don't educate or train their team enough? How would we broach it with people? Anyone?
Well, I mean, if I could just, I think that the problem, as we've identified, is that because of the cultural, how it's like that stigma. So if that is happening, how can, well, I suppose it's chicken and egg, and you have to start somewhere, don't you? So I suppose it's just inviting conversation. So I suppose I know that in the charity I work for, and that this is to support counsellors, that they've set up like coffee groups. So that will be, and it'll be on Zoom or something, but where people will buddy up and have a coffee and a chat. And then I guess you could even do that in a group. I mean, I know that we're all busy people, but it's making sure there's the time in there to allow for these discussions.
What about you, Donna? What do you think for your staff team?
Yeah, I think very much right there about buddying up. I mean, in regards to our staff, my HR manager took on the role of being a mental health first aider, and she actually went on a course and has made herself open to the staff. But going back to that stigma thing, she's made herself open to the staff, but the staff have got to want to talk, and some of them don't want to talk because somebody will know that I've been to talk to you. So sometimes offering out of work support is the way to do it. Some don't want to talk whilst at work because it's, well, where have you been for the last 10, 15 minutes? I've been looking for you. And what have you been talking about? I think we've probably found it ourselves. I mean, going back to when Sarah was talking, and I was thinking, gosh, those calls that you were listening to, who on earth was giving you support when you're doing that kind of job? And I think the one thing that us four have found is off air and away from work, we've got our own WhatsApp group, and we now know between the four of us, we can put anything in that group. And probably some of the stuff that we put in it, we probably shouldn't. But when we do, it makes us feel better because we know it's not just us. It is happening to somebody else. And just to have somebody as a peer, and they don't have to be the same level as you. It hasn't all got to be managers. It can be a carer and a manager or a domestic and a nurse or whatever. But just to actually have somebody say to you, do you know what? I feel like that too. And do you know what? That happened to me today. It's knowing that somebody else is in the same boat as you. And it's that old thing, isn't it? A problem shared is a problem halved. But it is the getting people to talk. And I think sometimes actually within the work environment, within working hours, that is quite hard. And I know we don't all want to be doing out of work time, but I think, sometimes perhaps to, offer that out of time or put people in touch is, it is the way to do it. And it's like, Jackie said, it is the chicken and the egg. We want to be there to support, but the people have got, it's like you can't take a horse to water and make it drink. We can provide the services, but the people have got to be willing to come to us and to talk. And it's how do we get them to do that? Because we know that there are so many people out there. And I don't think it is just about stigma. It's about what others think about us, So, I think mental health is spoke about a lot more. We're living in a very different world to what we lived 10, 20 years ago. But it is like, it's my own personal feelings. I don't want everybody to know about it. Yes, I want to talk to somebody. And I think that's why something like the Samaritans is just such valuable work. And to bear in mind that you are volunteers doing this, but somebody can just talk to you at any time of the day. And in the old times, we used to think of the Samaritans as people who were really on the verge of wanting to commit suicide. It was that kind of helpline. It's not. it's for anything. It might be something that you might think is so little and I don't want to bother somebody about, but to just talk to somebody on the phone, you don't necessarily need a tablet, you don't necessarily need a prescription or whatever, but just to actually talk takes so much pressure off your shoulders and makes you feel so better. And we see it on the TV, every programme, you know, come on, who's been watching Line of Duty? All of us. Oh no, Mark hasn't. But all the rest of us have been watching Line of Duty. You know, it comes up at the top of the screen. You know, it's good to talk. You know, we need to talk. And I think that's what we've got to do. We've got to start that conversation somewhere.
Sorry, Mark, you were going to say something and I cut you off.
Oh no, Donna stole everything I was going to say. It was about, you know, connecting out with people, and I was just going to say, you know, before we did this and during I'd never met you three guys, but actually, you know, that WhatsApp group helped me a lot. You know, when I was living away from my family and coming home in the evenings, and you know, to an empty dark house, you know, those videos of Adam singing or just the banter we had, you know, it really helped. And I think it is just about reaching out. And I think you'll probably find that if you reach out to somebody, they're probably going through very similar things to what you're going through, or they can definitely relate to it. I think one question I have for Jackie or Sarah is there anything that you can recommend or any top tips for how you recognise your mental health might be declining? So I know earlier I spoke about, you know, it wasn't until I left my role, you know, managing the care home, that I actually took time to think about, you know, I was actually so tired and worn out, and you know, I knew then I just really needed a break. But when you're in the midst of it, you don't actually notice all of that that's going on.
Well, I think that yeah, you're right. It is, when you're in it, really hard to recognise it. But I guess that there are the kind of obvious symptoms, which are around loss of appetite, not sleeping, overthinking, anxiety, depression, all of those things, which, you know, I mean, okay, that that's like a sort of diagnosis in a sense, but you know, like not wanting to get out of bed. There's also kind of, you know, various things that might take someone sort of down that path, if you like. But I don't know. What does
yeah, no, I think they're really good tips, and yeah, I think you know, I see Donna, Adam, Dawn nodding their head. I know I definitely relate to some of them, you know, not sleeping, lack of appetite. Yeah, they're all really good things.
Yeah.
Sarah, anything you can think of at all?
Yeah, I think quite a big one is like people become quite withdrawn. So I know from my own experience, when I think there was some time through the pandemic, there was one point at work where I literally felt completely overwhelmed by all of it, and I think it was kind of right in the thick of it, and obviously there's everything else going on outside, and sometimes, and I have seen it in other people that I've supported, that you become really withdrawn and you almost isolate yourself, you cut yourself off because you don't want to actually admit that you're struggling, or it's like you say, you don't want to get out of bed, but it's literally cutting yourself off and locking yourself away. And I find I don't necessarily want to talk to my family. I don't want anyone to know that really actually mentally I'm struggling a little bit. And when you're doing that, it's all inside. So once you talk about it or you share that with someone, that power is taken out of that. When it's just internally, it literally eats you up. So yeah, it's always, you know, I hear it in other people that I support in some of the other voluntary stuff that I do. When you keep stuff to yourself, it is like it makes you sick, really. Like they say, secrets keep you sick. So when you're not kind of being honest with how you're feeling and stuff, it seems to be magnified, and then you do share it with someone and you find out that actually they feel similar to you feel, and you think, why didn't I say something sooner?
Yeah.
So, yeah.
Well, it's been amazing to talk to you both, and I know that everybody feels the same. Thank you very, very much. I really appreciate it. Especially Sarah, who has to put up with me all day, every day, and then spends her evening talking to me on the Caring View. So thank you both. Thank you very, very much.
Thank you so much.
Yeah.
You're welcome.
this has obviously been I didn't want tonight to come across as negative, but I think at the same time, I think we needed to bring this awareness to the forefront that anybody can be affected and their mental health can be affected. I really appreciate everybody who come on to talk to us this evening. Any final thoughts, anyone?
I mean, I just want to say thank you for sharing your story with us, Dawn. I know you've done it in the WhatsApp chat with us, and it's, it's sort of fine when you're with mates and when you're with friends, and we're used to it now, But to sit here on our chat show and admit that you've had those issues is, I think, really empowering for so many people out there.
Yeah, I think it's just shown how important this is. I mean, let's be honest, we could have gone on for 2 hours easily tonight because it's just such a massive topic. And I think if anything can come from it, it is to say to people that whoever it is, it doesn't matter, a family member, a colleague, the neighbour, the dog, anybody who's going to listen to you, even just to write it down, even if you can't face talking to somebody, even to write it in a message or have a pen and paper or something, just to get it out of you and talk, and well done to all of you. We've all had really, really sort of difficult years in various ways. I can sit here and say I couldn't have done what you did, Mark, and I can't imagine what it was like for you, Dawn, and what you've gone through, Adam. So I just hope that people will kind of take a bit of it on board, hope that it's not negative, because it shouldn't be. It's about moving forward and being positive and just talking. Yeah.
My only final bit is I've dropped it in the comments, and I'm sure Dawn, Adam and Donna will say exactly the same. But if there's anybody that doesn't feel that they're ready to talk to a professional service, my DMs are always open. So, Twitter, Facebook, LinkedIn, drop me a message. More than happy to talk.
Yeah. I haven't got any Doc Martens, but you can personal message me.
So to kind of wrap things up a little bit, I just wanted to thank everybody for this evening. We have another amazing show next week, and I am not hosting. It is Adam. Thank goodness. So Adam, tell us all about next week.
Honestly, I'm so excited for next week. We're talking peer-to-peer support. So it's sort of a natural follow-on from tonight's episode, talking about how, as colleagues, we're there to support each other. And so next week, we're not predominantly talking about it in a mental health capacity, but it's about supporting each other professionally, sharing ideas, innovations and knowledge, and helping each other get through just the day-to-day normalities of work. So we're being joined by Jane Brightman, who is the social care manager for the Institute for Health and Social Care Management. If you are not a member, go and sign up now. They are fabulous. She's also the creator of an online Facebook group where I met the wonderful Mark, called the Outstanding Managers Network. So no one better, I think, for talking about peer-to-peer support with us. And we're also joined by the winner of influential social care or something recently, is it? Vic Rayner, the recent award. So Vic Rayner is the CEO of the National Care Forum, and she will be joining us as well. And between the National Care Forum and the IHSCM, they've also got a new partnership in regards to training and supporting people within the care sector. So I'm really excited for it. I'm really also excited because Donna's not with us next week, so it's going to be.
But can I just say, I am, for my own mental health, I am going to deepest, darkest Wales in my caravan where there is going to be no Wi-Fi, and I'm having 2 weeks out. But I just want to say that in my place will be the amazing and fantastic Natasha Wilson. So please do join us next week. My only worry is that I'm going to come back off holiday and find I've been kicked off the show because Natasha is far better than me, better looking, much younger, and is going to be fabulous. So please do join in next week. And I'm sorry that I'm not going to be here for 2 weeks, guys.
Well, have a lovely time in Wales.
Thank you.
Rightio, so that was for the night.
Sure.
Thank you all.
Thank you very much, everyone.
Thank you.
Yeah. Bye.
Bye.